but we will take any good news we can get right now. I want to begin by sharing a story that gives me great hope. It encourages me to see the spirit of Mississippi and how we are working together to combat this virus. This Sunday is Easter. It is a day when typically churches would be brimming, and it would bring me great joy to see our churches full on this Easter Sunday, and honestly on any typical Sunday. But this year, we face a unique challenge. We are just a couple of days from our peak resource use in our state, and that critical point at the top of the curve when COVID-19 will hit us the hardest. This is not the time to hold in-person services and fill our churches. Now, we've set a statewide shelter in place, and it's making a difference. It's had a great effect. We also know that this is still America, and the government does not have the right to shut down places of worship. When you start taking people's rights away, very rarely does the government ever give it back to them. Mississippi is not China, and it never will be. America's system of government relies on our citizens to step up and do the right thing. Mississippians are doing just that. Just a few days ago in this room, I was asked about Bishop Stanley Searcy's church in Natchez and whether we had the right to shut it down. I don't believe that I do, and frankly, I'm glad to live in a country where that's true, and I'm proud to live in a state where that's true. But I do have the right to call the bishop, man to man, and let him know what we're seeing from the data. I can ask him as a fellow Christian to take this extra step to protect the community. That's what I did, and he has graciously agreed to ensure that he would come before us today. I've asked him to pray, but I've also asked him to consider not holding in-person services this weekend. So, Bishop, at this time, I would like to hand it over to you to say a few words. I want to again reiterate that in America and in Mississippi, we're not going to be the kind of government that shuts down worships, services. But we are going to work together across all communities to protect our people. Bishop?
Governor, I want to thank you for inviting me here today. And I want to thank Greg, our MEMA director, and all of your staff. When I got the call for me to be here today, on a day or so ago, on Monday, before my Bible study, I was set to have it, and Greg called me, and my county manager, Rod Bradford, he kind of asked, Greg asked Rod, say, you know that church down there in Natchez? He said, yeah. He said, that's my pastor. And he said, but when he sets his mind to something, and he believed God has told him to do something, he'll stand. And he says he feel like his rights have been violated, his constitutional rights have been violated. And then Greg said, well, you mind if I call him? And my mind was still set to be able to hold services. But when the governor's staff, Greg, and he says several times, I'm calling you, I don't have a right to shut you down, but I do have a right to ask you not to hold service because it's endangering the lives of the citizens in your congregation. And when I went through all the things I told him we was doing, he says, you're doing everything the appropriate way. Our church holds 1,800, and we had 250. And Governor, the reason why we had 250 was because originally they started with 250. And then when they moved it to 50 and then down to 10, some of my local officials called me and said, if you had service, we're gonna lock you up. Well, then that's when I kind of planted my feet. I felt like my constitutional rights was being violated. Well, this is a horrific disease, and I understand that. I understand that totally. And I understand the severity of it. And I understand that how contagious it is and how many lives have been lost. And Governor, if you don't mind me saying this, but I'm a bishop in over 441 churches. And in India, my pastors get beaten up and threaten their lives, threatened because if they win somebody to the Lord and baptize them. In Africa, radical Muslims, not all Muslims are radical, but radical Muslims have stoned my pastors. And I never thought that the day would come that I would hear from my government, my local government, to lock me up. Well, I got a little fight in me. And that brought up my constitutional rights. This is a horrific virus, and this virus that we have has taken away our freedom where we can congregate together, and I understand the sincerity of that. And MEMA has done a great job, and the CDC. And it also has taken away our financial abilities now. And also, now, it was, to me, the corona was doing more than just taking the lives, and which is bad, in the financial situations, but it was taking away our Constitution, freedom. It was being challenged. I want to thank you, Governor. You didn't ask me to say this, but I want to thank you for all of America when these other governors was saying martial law, and you stood up and said, we're not China. I didn't vote for you. I voted for Jim Hood. He was my sheriff, which is a deacon in my church, and Jim was real good friends. I never met him. But I told my congregation, I say it publicly today, I thank you for being a Christian and a governor, and I'm so proud to have you, my governor of Mississippi. It's not about politics, it's about doing the right thing. And you're a straight shooter, and I thank you for that. So when they narrowed it down and they said that that's how we got here, and Governor, I'm here to do whatever you ask me to do, and I'll be willing to cancel my service on Easter Sunday to give you that time over to the 20th, that we can get our peak and our curve, and we can plateau this thing, because we don't want to see any more Mississippians die. But that was the only reason why I was doing that. I know lives are being lost, financial abilities are being lost. I just didn't want to lose my constitutional right.
Well, I understand that because your views are one that are shared by so many Mississippians. But we are not a group that takes kindly to the government invading our personal lives. But we also are a people that care about our neighbors and want to do the right thing. And so to Bishop Searcy, thank you so much for your willingness to do the right thing. And would you please lead us in prayer?
Yes, sir. Let's bow our heads. Father, we thank you right now that we have some challenges before us. We have an unseen enemy. If it was an enemy that we could see, we would be able to fight it with tanks and bullets. But this, as President Trump has said, this is an unseen enemy. And as our governor has said, we're at war. Lord, I ask that you would just bless the Magnolia State and our governor, all the staff. I ask that you would bless the first responders that's on the front lines, that's risking their lives and their family lives to take care of us. I ask that you will bless every municipality from this state capital all over. And then God bless our president, Donald Trump, oh God, to be able to lead us in the right way. He's been criticized so much, but Lord, he's doing the best he can do. Lord, direct him and lead him through. God, I ask you right now that we won't look at faults of others, but we'll appreciate others' opinions. But this is no time for us to be divided. Let us come together. Thank you for a good leader and Governor Tate Reed. Bless us to be Mississippi strong and to do what we need to do. In Jesus' name we pray. Amen.
Amen. Thank you, Bishop. I also want to share a message for all Mississippians, particularly those Christians for whom Easter is a very precious day. No disease, no virus can cancel Easter. We believe as Christians that Jesus conquered death. We can celebrate personally in our homes with our families and virtually with our other Christians around the globe via the internet or television or radio. We will honor the resurrection while protecting our neighbors. The church is not a building. Easter is not about eggs. Pastors, as you plan your worship for Sunday, please, I'm asking you as one of your own, protect your congregation from this virus. Just as the bishop said that he was willing to do, not because we as a government are making him do it, because we asked, because we showed him the data, because we urged him, and because he wanted to do the right thing. Do not stop worshiping, but do not put our people at undue risk. More generally, in dangerous times like these, when everyone is scared, I've seen a lot of attempts to shame people into submission. I understand why people feel so strongly. They're right to be so passionate. Lives are on the line. But I think there's a better way. When you try to shame someone into changing their behavior, they're more likely to react negatively. You're probably hurting your own position. A strong, meaningful reminder of the consequences might work better. Again, lives are on the line. We have to get everyone to understand the risk. This disease is deadly and extremely contagious. We can only save lives if everyone works together. These are still your neighbors we are talking about. They are still Mississippians. I really don't believe anyone wants to spread this virus. In today's world, when overstating for the effect is the norm, some just have a hard time believing such warnings. I get it, but this is different. This is real. We will enforce our orders as much as we can, but we can't catch everyone before they act. We need all of our people to believe in this cause. People ask about a full military-style lockdown, requiring papers for transit and military roaming the streets to catch anyone who ventures out of their home. That's never going to happen in Mississippi. I don't have the right. So that means we're counting on you to help spread the word. We need you to continue to step up. And I believe that Mississippians, just like the bishop, are continuing to do that. Help your friends and neighbors understand and try to do it with kindness if you can. It will help save lives. I also want to give an update on our schools in Mississippi. I have been encouraged by the efforts of teachers and parents to excel at distance learning. I know that's not easy, but it's working in many cases. It's not a perfect solution for everyone, but it is the right plan for this time. I've previously told you that we are considering the data to inform our decisions on schools. I want people to be able to plan. I've spoken to many parents and many school leaders over the last several weeks and months, and I want you to know that I understand the need for your ability to plan. Therefore, I am committing to provide a clear guidance by no later than Tuesday of next week on our school plan going forward. In the meantime, I will be consulting with education officials and getting their guidance. Mississippi students have already proven their exceptional ability to learn under tough circumstances. Teachers, administrators, and parents are owed a tremendous debt of gratitude for their efforts during this time. I'm committing that by Tuesday, we will announce our intentions for Mississippi schools. Please give us those days to examine the trends in our state, and we will make an announcement at least by Tuesday and possibly sooner. With that, I'm going to thank the bishop again, and I'm going to ask Dr. Byers to come up and give an update on the numbers that we have seen on COVID-19.
Good afternoon, everyone. Thank you, Governor Reeves. We did notice that there were slightly less numbers of cases reported yesterday than in the day previous, but we did have several deaths still in Mississippi. And, you know, I think for the short term, we may continue to see some fluctuations in the number of cases reported. We hope to see some consistent downturns eventually, but I don't think that we're at that point yet, and I don't think that we've reached our peak. But we know that in the coming several days, that'll tell us more, for sure. Since we first reported our very first case back in March, we've learned a lot about what the data is showing us. There's still a lot that we don't understand about this virus and who it impacts. But we do know that it has a tendency to affect those individuals who have chronic underlying health problems, things like diabetes, heart disease, kidney disease, liver disease, those underlying health problems that can compromise your immune system. We know that individuals who are elderly, especially over the age of 60, are more impacted by this disease. We see more complications, and certainly we've seen more deaths in those groups. When we look at the data now, and we did give an indication of what the data was showing us yesterday, we're seeing some significant disparities, some racial disparities in both the percentage of cases we're seeing and the deaths. We're seeing now, and we have reported this data, and we'll continue to update it on a daily basis. 56% of our reported cases so far are in African Americans. 72% of the deaths that we've reported are in African Americans. And when you break down those deaths and when you look at them, we're seeing significant incidents of diseases like diabetes, heart disease, liver disease, lung disease, those chronic underlying problems that we know exist in Mississippi already. And we know that there are racial disparities in those diseases already. And we are seeing impacts now. You know, so what is the message? Well, the message has been the same from the very beginning, and that is, you know, if you have those underlying chronic health problems, if you are elderly, especially if you have those diseases and you're African American, now is the time to continue those measures that have been in place, social distancing. You know, if we can, you know, we know that young, healthy people, for the most part, it's a relatively mild infection that they recover from. But we know that they can be the source of infection for those people who are most vulnerable. We all have to play our role to reduce our risk of infection. And when we do that, not only are we protecting ourselves, but we're protecting those people around us who are most vulnerable, people who may live in our household. So we want to continue those measures. We're not done with this yet. This has been an extraordinary pandemic. And, you know, I love the way that everybody has come together and has taken on that responsibility to play their role in preventing transmission. This is really a group effort. It really is. And we're very appreciative of all the continued efforts. So the biggest message is everybody needs to stay tuned and stay aware and continue to practice those measures that we've been saying the whole time. Thank you.
Thank you, Dr. Byers. I want to let Greg give us an update from the emergency management perspective.
Thank you, Governor. Just to give an update, again, I know that PPE continues to be the heart of a lot of anxiety out. So just to give you an update on some of the things we received in, just yesterday we got in about another 6,000 disposable gowns, about 5,000 face shields, 24,000 KN95 masks, and 49,000 protective gowns. Those, all that product was brought in, broken down, and shipped out, not only to the counties, but also to the Tier 1 healthcare facilities. We are anticipating receipt, finally, to receive the large shipment that we're getting through FEMA from USAID, and that shipment is supposed to be en route from Miami, and we should get that sometime tomorrow. And then it'll take a couple of days for us to break that out and get that out on shipments to be pushed out as soon as possible shortly thereafter. Distribution that we pushed out, about 362,000 pair of gloves, 35, almost 36,000 KN95 masks, and almost 2,000 Tyvek suits that we pushed out to those communities. So just a quick update on that. We're pushing it out, Governor, as soon as we're getting it.
Thank you. That's something that we will continue to do. Obviously, it's always a challenge for PPEs in these difficult times, but we are beginning to get more and more in, and we will get that distributed out through our typical distribution network. Scott?
Regarding the school decision, are you looking at also the possibility of extending the school year or just wrapping it for the year and continuing distant learning?
Well, I would say at this point we haven't ruled anything out. We are looking at all of our options. I'll be speaking over the next several days with a number of local school superintendents, school administrators. I'll also be speaking over the next couple of days with our chairman of our board of the State Department of Education, as well as our director, superintendent, Dr. Wright, and others, and we'll make a decision, a joint decision, as we did when we initially shut things down until the April 20th date. We'll be having conversations with them, and we'll also be continuing to watch our data as it comes in on a daily basis.
How much does that April 30th recommendation by the federal government play into those decision-making points?
Well, what I would say is obviously the April 30th date that the federal government has put out is certainly will play a role in our ultimate decisions. But remember, every state and every region of the country is in a different part of their cycle. For instance, in New York, by the way, there's a little over 400,000 cases nationwide. Almost half of those still are in New York and New Jersey. It's just over 190,000 of the 400, so just under half. But it appears that they are probably at their peak resource use right now. We are projecting that ours could be 10 days from now, 12 days from now, and so every state is different, every region is different, and so we'll continue to monitor the data, but that is certainly a factor that we'll take into account. Yes, sir.
In a state where 38% of the population is black, the numbers have to be eye-opening to you. What are you going to do to make sure that the numbers, one, are lowered, and two, this doesn't happen for the next pandemic?
Well, you know, the thing that that we have to realize is that one of the reasons there is such a disparity, there's lots of reasons, one of which is the underlying health conditions within the African American community has led to, particularly on the death side. We also are working very hard right now to continue to get more and more compliance. I think 90% of Mississippians are complying with what we were asking them to do, the shelter-in-place orders and et cetera, and that's something that we're going to continue to do. We've got to continue to work as we have done for many, many years, but we've got to do even more to really work to get all of Mississippi healthier. When you start looking at where the state as a whole ranks on things like obesity and hypertension and the number of smokers, I mean, those are areas in which we are uniquely challenged, and one of the reasons why we ultimately issued the shelter-in-place order.
So Just to follow up on that, what exactly is the plan? I know you've said time and time again, we have to get healthier. How do we get healthier when we don't have grocery stores with healthier options in certain places in the state, food deserts and things of that nature? Many of these people probably don't have health care.
Well, I think we find ourselves in this particular pandemic in a situation in which everyone has access to health care. We as a state, and quite frankly, we as a nation, have to, particularly in rural areas, have to continue to work to approach both accessibility and affordability of our healthcare system. I think that's critically important. I think all of us need to make even better decisions when we can, but there's no doubt that that we started this particular phase before this pandemic in a situation in which our health stats with this particular disease, our health stats made it particularly challenging for many of our people.
I want to follow up with Dr. Byers on that subject matter and not know if there is an easy answer to it, this correlation of health issues with our African American population and the deaths and people who are getting really sick. Can we draw any reasons on why we're seeing that?
I think, there is so much that we don't know about this virus and how it impacts people. I think it's very premature to draw a lot of conclusions based on the data that we're seeing now. We're just going to need to continue to watch the trends. I think we just need to protect everybody, though. And we just need to make sure that we're all practicing those sorts of things that we need to do to prevent infection.
I will say this, it is my understanding, and I commend Dr. Byers and the entire State Department of Health. I believe that we are one of the first 10 states in America to actually issue demographic data from this particular virus. They've been very proactive in that, and I commend them for it. But if you look at the disparities amongst demographics in the other states that are providing it, they are seeing very, very, very similar data. I think that's fair to say that in other states, this particular virus is affecting, again, some in the minority communities more so than otherwise.
I didn't know if 56% was the norm. Were we high on the curve or low on the curve, or whether you can even reach that yet?
I don't know that enough states have reported to really tell us where we are on the curve, but certainly, the percentage of deaths is consistent with some of the other reports that have been out there. It's going to be interesting as more states and more localities report that data.
Yeah, and I think one of the things, and we've had a lot of conversations with the Department of Health over the last several weeks regarding data and what is released and what is not, and one of the things I just want to make sure everyone understands is you don't want to release data too early before you actually have enough cases to get a really good feel for what that data is really saying, because you may just have a sample size that is far too small. But just keep in mind that Mississippi has somewhere between 35 and 40% of our total population is African American. And so with a 56% infection rate, what you're talking about is it's about 135% of if it were actually affecting different races at exactly the same pace. Now, and that's obviously with 2,000 cases, roughly where we are now, that 30 or 30% you would expect. If everything were even, 40% of 2,000 is 800 cases amongst African Americans, and if we've got 55%, 56%, that's probably a couple hundred more out of 2,000 than probably we would have expected if everything were equal. But again, I really do believe it's those underlying health issues, particularly when you look at the number of deaths. Courtney?
Going back to the church conversation, because the locals are the ones who are enforcing the order, how many questions has your office received from the local authorities regarding what they need to do? I know that the bishop mentioned he never thought he'd find himself in a place where he had a threat like that. Has your office received a lot of direct inquiries about what do we do if a church does decide to hold a service?
We have received inquiries. What we have said to local law enforcement, we don't believe that the sheriff ought to be going and arresting pastors in Mississippi. In fact, we believe that churches are essential operations in our state. But we also believe that we need to make wise choices and wise decisions, and we don't need to be gathering in groups of more than 10 people just because of the seriousness of this particular virus and how contagious it can be.
Does that still remain where we think the most expedited spread of the virus has occurred in funerals, church services, and things like that?
Those close contacts. Any place where we have people who are in close proximity with each other, regardless of the type of gathering, we can see transmission that occurs.
I didn't know if it was like the clusters in some of the research you've done were like, yeah, these areas where there were church services and that's where they busted out.
You know, we've seen some small clusters that have been associated early on with in funeral settings and in settings where there were larger groups of people who were coming together. We're not seeing as much of that now, obviously, because we are seeing more social distancing.
But look, I think it's important to say, I know how hard it is. When you lose a loved one, I mean, how many of us have stood in lines at the funeral home for hours just to go up and say hello and tell someone who has lost a loved one how much we love them and how much we want to pray for them. We've all done that, and most of us have done it a lot of times, and most all of our pastors do it every single week, and some have to do it most every day. And so this is really hard, but I do believe that if we can practice social distancing, if we can just hold off for another couple of weeks, our shelter-in-place order goes until April the 20th. If we can make good decisions for the next couple of weeks, I do believe that we will have been able to slow the spread to a point where our hospital system is not overwhelmed, that every single person that needs critical care can get the critical care that they need. And that's our ultimate goal, is to do everything we can to make sure that our hospital system and our healthcare system is not overwhelmed. That's when you find yourself in a position that, in my mind, is just not acceptable when you're having to turn patients away. That is not what we want to see happen in Mississippi, and I'm hopeful that doesn't happen in any other place around this country. It happened in other countries. We know that. It happened in northern Italy. It happened in other places. But all of the planning that we have done for the last, really our pandemic plan's been in effect for a long, long time, but all the planning we've done for the last several months has been to avoid that scenario. Yes, sir.
Dr. Byers, what's the rate of the false positives that you're seeing, and how is that being accounted for?
You know, we don't really have a false positive rate. What we have, and this is a highly sensitive and a highly specific test that's being run. And so what we're seeing is cases, right? We don't have an indication of what a false positive rate would be.
I was with Congressman Guest this morning. He was donating blood in his district at the Mississippi Blood Services. They're in dire need of blood. The director says that they're seeing a 41 to 48% cut in blood donations. Congressman Guest also challenged you to donate a pint of blood. So,
I haven't gotten that text yet.
How can you encourage Mississippians to get blood? I mean, the hospitals are still open for those people that are in those car accidents that require lots of blood. How can you advocate for them to donate blood?
Well, that's a great question, and I appreciate it. And I do want to, first of all, commend Congressman Guest for giving blood this morning. And I want to encourage all Mississippians to please be willing to help us. We do have a blood shortage in Mississippi. You know, one of the things that has happened within the healthcare system over the last several weeks is with the elective surgeries not happening, with people staying at home and therefore driving significantly less. We are seeing less automobile accidents. And so many hospitals actually are seeing their overall patient loads down 30–40% if you exclude COVID-19 patients. And so, but your question is exactly right, very valid. Please, Mississippians, if you can donate blood, please go do it, because we do have a shortage right now.